السلام عليكم ورحمة الله. أنا دكتور مثنى حموشي. إن شاء الله اليوم راح نكمل محاضراتنا بخصوص مادة الكسور. محاضرة اليوم راح تكون بعنوان femoral shaft fractures and traumas around the knee. السلايد الثاني please. So we have some important notes about fractures of the shaft of femur. The first important note is that the femur is well padded in muscles. احنا نعرف انه الفيمر مغلف بعضلات قوية و thick muscles, and it's relatively protective against the trauma. So when the fracture happens, it demands a very big force to cause the fracture. And this big fracture can also, we should also always remember that this big fracture may lead to associated injuries in muscles, in soft tissues, in vessels, and maybe other organs. So this happens in young adult people, and in other fragments are displaced by muscle pull. This is another important note, that you should know that some muscles are attached to the femur, which make the displacement usually big, and its close reduction is usually very difficult. Next please. The next slide is, you see in elderly, the fracture, unlike the young people, usually is pathological fracture until proved otherwise. Why do we say that? Because as we know, when an old man or a woman falls on the ground, usually they have fracture in the neck of femur. But when the shaft is fractured, it means that there's some problem inside the shaft. Maybe it's a pathological, as in this X-ray مثل ما أشوفه بهاي الأشعة أنه أكو some osteolytic lesions in the shaft of femur. This might be a metastatic lesion in the femur. In children, think of physical abuse. Alhamdulillah, fortunately we don't have this physical abuse problem in our locality, but abroad they always think about child abuse. Next slide. You see this is an X-ray of femur with a fracture in the lower third, and if you look carefully you will see there is some areas of bone rarefaction, يعني مكانات تنخر بالعظم, and there is a fracture. This fracture is a pathological one after acute or chronic osteomyelitis. Next please. Of course, next to the examination you should send the patient for an X-ray. And what would you expect to see in the X-ray? Usually there is some comminution and sometimes you don't see this comminution in the plain X-ray, but intraoperatively you discover that there is some comminution. Why is that? Because as we said, this is a well padded bone مغلف بعضلات كبيرة. It is thick muscles and protected, and it demands a very big force to fracture. This big force usually leads to some comminution. X-ray of the pelvis and knee also should be taken to avoid missing injuries. Next slide. How to treat fractured femur. Again, remember the risk of systemic complications. احنا عندنا big trauma, big bone, big muscles, and we might have bleeding and shock. We might have DVT and pulmonary embolism from a bedridden patient, and fat embolism, and all the other complications of a bedridden patient. All should always remember them. So remember the risk of complications, because if you remember these complications, this will make it easier for you to predict them, تتنبأ بها, and then you start the treatment as soon as you suspect one of them. Next please. Now, of course, when you receive a patient in the emergency unit, you should do something to relieve the pain of the patient, to limit the trauma, to limit the extent of soft tissue damage. So the first step is to put a patient in splint or traction to reduce and hold the fracture in a reasonable alignment and to reduce further tissue damage and bleeding. Example like Thomas splint. In this picture you see that this old lady has been put on a skin traction. مثل ما قلنا انه انت مجرد ان ترجع العظم في وضع معقول، ما شغلنا احنا بالطوارئ انه نرجع العظم perfectly 100%. شغلنا انه نخلينه في وضع معقول، ما خيفد severe acute angulation, because this will lead to movement of the fragments inside the tissues, soft tissues, and will lead to severe pain, further damage to the soft tissues, and would make things more difficult for the future. Next, please. See, traction is one of the methods of treatment. Traction is indicated in children. Sometimes we use it as a definitive treatment in children, as we are going to see in the next few slides. بعد شوي راح نحكي عن fracture in children of the femur. But it is contraindicated when there is contraindication to anesthesia. Maybe that was in the past years actually. قبل كانت الأنستيزيا is not as well developed as now, and lack of skills and facility for surgical therapy. احنا في مكان معزول وما عندنا facility. Well, this is also very relative now because transportation and facilities are everywhere. And also temporary while waiting for surgery. And this is actually the most important indication, which is temporary holding of the bone until we prepare our things for surgery. مثلا المريض نحضر له فحوصات، نحضر له blood، نحضر له if he has another problem like for example abdominal injury, head injury, we stabilize the general condition of the patient, and then we go to the surgery. Next slide. See, in this slide you see the first upper left slide. You see the Thomas splint. How does it look like? It looks like a padded ring. فد حلقة مغلفة بإسفنج أو ربر. ليش هاي الإسفنج أو ربر راح يدخل بداخل الرجل ويعني it will be support for the groin، يعني راح يستند إلى الجروين. والother part اللي هو هاي long iron parts، هاي اللي راح تكون support for the leg, and the leg will be towed to the end of this Thomas splint, as you see in the nearby picture. This is downward. You see another example of traction for a child in bed. طبعا هذا Thomas splint we usually use it for transportation. يعني أنت بالإسعاف نزلت و you are trying to transport the patient from somewhere to the hospital, from the accident scene to the hospital. You tie the Thomas splint even to the shod foot، يعني حتى ممكن تشده على الرجل هي والحذاء إذا ما كنت تريد تعمل further trauma to the leg، إلى أن تصل المستشفى. بعدين you change into another type of more definitive traction. Next slide. Well, contraindications to traction. So these are also relative contraindications, like in elderly or pathological fracture or multiple injuries. But this is a contraindication for traction as a definitive treatment. بس احنا مثل ما قلنا هو بكل الأحوال احنا أغلب الأحوال عم نستعمله as temporary type of traction. Next. Drawbacks of traction, and what are the bad things about traction? So the bad things about traction, it takes a very long bed rest. طبعا هذا أيضا في حالة أنه نستعمله as a definitive treatment. It takes a prolonged bed rest, maybe 10 to 14 weeks. احنا حسب البيركنز تايم تيبل مثل ما نتذكر. أنه fracture femur would take 10 to 14 weeks in an adult to heal. This is a very long period. Imagine أنه تخيل أنه شخص يقول لنا تتمددون بالسرير لمدة 3 أشهر. It's a very long period, right? So this is why we are now changing or shifting more towards surgical treatment. So, you know, the attendant problems of prolonged bed rest are DVT, UTI, bed sores, pneumonia, joint stiffness, malunion, skin problems like irritation and blistering and necrosis, neurovascular complications, and other complications which are not mentioned here, like muscle wasting. Next, please. Open reduction and plating. This is another modality of treatment. Anyway, it's out of favor because of high rate of complications like implant failure and infection. And besides, it takes a very big incision to open the wound, to open the bone, and to apply the plate, and this might lead to devascularization of some parts of the bone. But it's still used in some situations, and in many occasions actually, like when there is shaft and neck fractures. You mean shaft of the femur with fracture of the neck of femur, fractures near joint or extending into the knee joint. So, and older children and adolescent patients with open physis. Why is that? يعني بصورة عامة we use the plate usually when the fracture is nearby a joint, knee joint or hip joint, or when the child still have open growth plates. ليش؟ لأنه راح نيجي نشوف الطريقة التالية اللي هي الايديال أو الميثود اوف تشويس اللي هي nailing اللي هي الانتراميدولاري nails، هي الميثود اوف تشويس حاليا، لكن ما نقدر نستعملها بالادolescents and those with open physis because as you know the medullary nails go into the medullary canal through the bone ends, and this might destroy the growth plate. So we prefer plates in these situations. Next slide. You see, this is an example of implant failure for a plate of the tibia. This is the screws were pulled out of the bone. And the next slide we talk about intramedullary nail with interlocking screws is the method of choice for treatment of fractures of the femur. This is actually the method of choice because of the rapid rate of big rate of healing. It can be done with minimal incision or even with a closed method. انت ما تحتاج تفتح الكسر احيانا، مجرد انه تفتح فتحة بنهاية العظم and then you admit the nail inside the medullary canal and you look at distally and proximally. This makes it very good because you are not devascularizing or stripping the bone at the fracture site. This will make healing faster. Besides, mechanically speaking, the nail is in the center of the bone, and when it's mechanically speaking, when it's in the center of the bone, it's called load sharing. It takes some of the load and it makes the bone share some of the load. This will stimulate the bone to heal better, and the rate of implant failure is much less than plate which is put on the surface rather than on the center of the bone. Next, please. External fixation. You know, external fixation is still in use in some situations, and the most common and most popular use of external fixation when there is open fractures, like in this X-ray you see the shells of bullet injury. This means that this is a comminuted fracture with shells of an compound or open fracture. Second indication is multiple injuries to reduce operating time. احنا من يجينا الشخص وعنده إصابات شديدة ومتعددة بكار اكسيدنت أو مثلا blast injury، فنحتاج فد شيء سريع حتى just to stabilize the bone while we are doing other things for life saving, like laparotomy or craniotomy or whatever. So you only put shanzes up above and below the fracture and connect them externally with a bar in a reasonable position في وضع معقول، ما شرط يعني اللي يكون 100% reduced. This will make future changes better, يعني future treatment better and easier for the patient and the surgeon. Bone transport or bone loss. This is a different subject. Maybe we can talk about it in another situation. But in general, bone transport for bone loss means when there is a defect in the bone, you can lengthen the bone and fill the defect that happened in the bone by lengthening the intact segment. وأخيرا in adolescents, this is a relative indication. يعني احنا مثل ما قلنا in adolescents sometimes we don't want to do big trauma to the patient and we don't want to disturb the growth plates at the ends of the bone, so we just do closed, for example, a closed external fixator, and they will heal well within a short period, 2 or 3 months. Next slide. See, this is a picture of a boy or of a man or a boy. This is a man, sorry. A man with a compound fracture of the femur. This is Gastello 3A. The femur is outside, the soft tissues are disturbed. So you have to deal with it with the classical way, as we learned, by washing, irrigation, debridement, external fixation, soft tissue management, and so on. So antibiotic, anti-tetanus. Next slide. Treatment of femur fractures in children. Actually, it is fairly common in children. نشوف أطفال كثير يجونا على الطوارئ وعلى الاستشارية وعلى الردهات عندهم fracture femur. How to deal with it according to the age of the patient. So based on fracture pattern and patient age نعتمد على شكل الكسر وعمر الطفل. Infants younger than 6 months can be treated with pelvic harness. هذا الطفل رضيع أحيانا وقع من إيد أمه، وأحيانا يجينا مثل بشكل birth injury، يعني الطفل أثناء الولادة من ينسحب من بطن أمه يصير عنده fracture femur. أحيانا لا، مثلا الطفل هو infant، الطفل آخر شيء له وقع من إيده أو وقع من إيد الأم، ممكن وارد أن يصير عندنا fracture femur. We have seen many cases like this. So in this way we can use the same harness or the same pelvic harness that we used for DDH. نفس البابليك harness، نفس الحزام اللي استعملناه لعلاج DDH بالinfants ممكن نستعمله أيضا. It's very nice results with this harness. Next, patient younger than age 6 to 5 years can be treated with early spica casting or traction and delayed spica casting. فإما أنه نأخذ هذا الطفل اللي عمره أقل من 5 سنوات ونأخذه على صالة العمليات ونجبس له هي، نعطيه فد أنستيزيا، جنرال أنستيزيا، ونعمل تراكشن، نحاول نحصل أحسن وضع ممكن، وبعدين نجبس in hip spica cast. أو في بعض الأوثرز يفضلون أنه يعمل تراكشن يحصل فد alignment معقول و early callus، يعني they say until the bone is sticky، يعني يبدي يلتصق العظم ببعضه، وبعدين هذاك الوقت نبدي نخلي السبايكا كاست. And finally, patients between ages 5 and 11 can be treated with a flexible intramedullary nail. What is a flexible intramedullary nail? Again, this is a nail, flexible nail, looks much more like a K-wire إذا أحد منكم شايف الK-wire, but it is usually made out of titanium. It is flexible. الحلو أنه إحنا ما نحتاج ندخل من ال growth plate. We go through the metaphysis rather. المسألة الأخرى اللطيفة بهذا النيل أنه we don't have to open the fracture again. Usually we do it in a closed manner under X-ray control, عندنا اكس راي بالعمليات اللي هي فلوروسكوبي او سكرين، نرجع الكسر بوضع جيد ونعمل فتحات صغيرة بالبون وندخل الى ان نثبت الكسر. راح نشوف بعض الاشعاعات حتى نفتهم القصة. هذه الصورة التالية هي لطفل is being treated with a hip spica under general anesthesia. See, the anesthetist is trying to make the patient anesthetized. Next, this is a flexible intramedullary nailing for fracture femur. See, two nails are introduced through the metaphysis and the bone is fixed, and see the very good callus around the fracture has formed. This makes the patient ready to go around very early. Next slide. Now we are done with the fractures of the femur. Now we should go a little bit down, which is the supracondylar fractures of the femur. Supracondylar fractures of the femur. Again, احنا دائما القاعدة تقول in young adults these fractures happen after high energy injury، يعني مثل car accident, fall from height، فد big trauma، motorcycle injury مثل ما نشوف هاي الأيام كثير. But in elderly osteoporotic people it happens after a trivial injury، يعني وحدي وقعت عثرت بالحمام عاد تتوضا وقعت، وحدي عثرت بحيفة السجادة وقعت. This happens with a trivial injury. And the difference here between young people and older people is that in young people and adults, you see it's a big force, might cause big stripping of soft tissues, big damage to the muscles, may be associated in neurovascular injuries or other injuries, abdomen, chest, head, and we need to look after the ABC. Another point is, the third point is, sometimes the fracture extends into intercondylar space، يعني الكسر supracondylar فوق الفيمر ويمتد إلى الخط، يرسم خط منتصف بين الكوندايلز. يعني إيش معناته؟ معناته it extends to the articular surface, goes to the knee joint. Next slide. You see, this is an X-ray of a patient with supracondylar fracture of the lower femur, and if you follow the line in the middle, it goes right into the knee joint, in the middle of the knee joint, the intercondylar extension. This makes the fracture an intra-articular fracture also, which needs perfect reduction and fixation. Next. هاي فد صورة لclassifications of supracondylar fractures with or without intercondylar extensions. You can look at these drawings، هاي الرسومات ممكن بس تدحقون عليه حتى تتخيلون انه اشنو الممكن اللي يصير بهاي. احنا ما نطلب منكم هذا الكلاسيفيكيشن طبعا، ولكن يعني اريد تاخذون فكرة عن الموضوع. Next slide. Treatment. Usually treatment is open reduction and internal fixation. Open reduction and internal fixation. Like the most popular is plates and screws. طبعا plates and screws بها أشكال وطلعت أجيال كثيرة. من الجيل اللي كنا نعمل contouring of the plate، احنا نعوج البليت حتى ياخذ شكل البون، وبعدين استعملنا أيضا ال plates اللي راح نشرحه يمكن في سلايد آخر. ولكن الألطف شيء هو هذا اللي قاعد تشوفونه بهاي الإكس راي، اللي هو اللي احنا نسمينه anatomical plate. This allows you to put a plate that takes the contour of the bone. هي أصلا pre-contoured حتى تأخذ شكل البون. It takes very big number of screws to hold this distal small segment. Usually it's made out of titanium، ولو المادة ما مهم يعني كلش، ولكن usually it's made out of titanium. Next slide. Now we go a little bit further down in the knee joint to the tibial plateau. Tibial plateau. So what is tibial plateau? plateau يعني يمكن لو نترجمها تطلع انه هضبة يعني مرتفع، فهو الجزء الأعلى من التيبيا. الهضبة الجزء الأعلى والسطح العلوي للتيبيا. tibial plateau fractures. This tibial plateau can be fractured in many ways. So the first point, fractures of the superior articular surface of the tibia. This is the definition. Second mechanism, usually medial or lateral bending force with axial loads, like for example a bumper fracture. يعني ايش معنات هذا الكلام؟ اذا شخص واقف وجدته فد فورس مثلا عيعبر شارع وسيارة بالدعامية، البامبر معناها الدعامية مع السيارة، اذا البامبر طخته بالجهة الجانبية من الركبة، فلو نتخيل انه the lateral condyle of the femur will hit or will strike against the lateral condyle of the tibia. راح يصطدم التيبيا بالفيمر، فالفيمر راح يكسر ال upper surface of the tibia بهالحالة. أو إذا صارت الفورس معاكسة من الداخل للخارج، بهالحالة الميديال كوندايل راح ينكسر، مثل ما واحد خلينا نتخيل أنه واحد وقع من سلم من مكان مرتفع. So what are the clinically what are you going to see? Next point is doughy swelling of hemarthrosis. doughy معناها مثل العجينة مثل ما تعرفون، راح يكون تورم يشبه إذا نمسكه ما مثل الماء مثل اللي يصير بالجوينت فيوجن، ولكن الهيمارثروسس عادة الدم يبدي يثخن، يكون doughy swelling. diffuse tenderness أكيد راح يكون severe pain and tenderness and inability to move. May be associated with knee ligament injuries also. Collateral ligament and cruciate ligaments can be ruptured in this type of injury. احنا قلنا هي هاي الفورس راح تعمل twisting or bending of the knee in certain degree angle, and this bending force can lead to injury to the ligaments also, like cruciate ligaments and collateral ligaments. X-ray, one or both condyles may be fractured with varying degrees of comminution. يعني ممكن احنا راح نشوف هاي الصور المرسومة او العفو الرسوم، هي طبعا كلاسيفيكيشن لهذا النوع من الفراكتشرز. شوف ممكن اللاترال كوندايل بأول صورة، lateral condyle with some depression, medial condyle in type D, both medial and lateral condyles in type E، وهكذا يعني different severities of injury. But the point here طبعا X-ray is very useful and very essential for the diagnosis, but the point here is that if you want to go to do surgery you better have a CT scan. الأفضل أنه تعمل CT scan. You have better understanding of the extent of the fracture, of the geography of the fracture, if I can call it like that. راح تفتهم تضاريس الكسر حتى تعرف منين تدخل وشون تخلي التثبيت مالك وهكذا. Next slide. Now we talk about patella fractures. Patella fractures. As we know, what is the patella? The patella is the largest sesamoid bone in the body. هو العظم السائب الأكبر بالجسم. طبعا هو موجود anterior مثل ما نعرف anterior to the femur or anterior to the knee joint. It facilitates the movement of the quadriceps muscle through the quadriceps tendon or patellar tendon. It increases the force of the quadriceps. فبها functions كثيرة، وهي bone طبعا هي موجودة في مقدمة الركبة. هذا يجعلها معرضة it's more prone to injury by hitting against hard surface، مثل ما يصير بالداشبورد injuries. يعني إذا مثل ما تذكرون قلنا الداشبورد injury من تصطدم الركبة بالدشبول مع السيارة خلينا نقول ممكن تتفتت، أو مثلا واحد عيل لعب كرة قدم وطاغ ونزل على ركبته انكبح، ممكن تتفتت، سقط من مكان عالي. لكن اكو another mechanism احنا قلنا it's part of the quadriceps mechanism، يعني هي مرتبطة بالquadriceps muscle which is the very big and powerful muscle. If for example somebody falls from height, this big muscle can pull the patella due to sudden violent contraction, can pull the patella and put it into two parts، يعني يقطعها إلى نصفين مثلا. نرجع للتكست مالتنا. It is of three types. undisplaced crack، مثل ما قلنا واحد اصطدمت ركبته في سطح صلب مثل الدشبول، صار بها تصدعات أو فطر خلينا نقول، ولكن هو undisplaced. ممكن هاي التصدعات تكون أكبر. next اللي هو stellate comminuted fracture، يعني كسر نجمي due to direct blow on the front of the knee. والثيرد تايب هو الترانسفيرس فراكتشر، هذا اللي عادة يكون كسر عرضي بالعرض، واللي هو هذا عادة يكون نتيجة تراكشن فورس مثل ما قلنا like fall from height، اللي هي طبعا indirect force. يعني أول نوعين اللي undisplaced crack والstellate comminuted fracture عادة ينتج من direct trauma، يعني في الضرب مباشرة على الباتيلا. لكن الترانسفيرس fractures اللي عادة كثير مرات يجي بيها big gap، هاي عادة due to indirect force، هي due to traction force of the quadriceps mechanism. The quadriceps mechanism in this last example، بما انه انقطعت الباتيلا، زين الكوادريسبس وين تنقل الفورس مالته الى الني او الى الابر تيبيا، ما ابى الوسيط حتى ينقل اللي هو الباتيلا. فبهذه الحالة we are going to lose the quadriceps mechanism، يعني المريض تقول له مد ركبتك للأعلى ما راح يقدر، لأنه he has lost the quadriceps mechanism. Next slide. See, this is an example of undisplaced crack of the tibia. Undisplaced crack of the tibia. هذا كسر ولكن ما متحرك من مكانه. Clinical assessment. Next slide. How to assess clinically. أكيد احنا راح مثل ما نتوقع أنه this is a trauma to the patella which is part of the knee joint. There will be some degree of hemarthrosis. So if it is very big hemarthrosis you have to aspirate it، يعني إذا أكو bleeding كلش كثير لازم تسحبه طبعا. Next, ability to extend the knee اللي هو integrity of the quadriceps mechanism. مثل ما قلنا إذا كانت الباتيلا مقطوعة أو متفتتة وصار بيها gap، the patient will never be able to extend the knee. يعني تقعده على كرسي تقول له علي رجلك ما راح يقدر يعلي رجله، اللي هي حركة جدا مهمة طبعا بالمشي وبالحركة وبالصعود وبالنزول. But remember differential last point differential diagnosis اللي هو congenital bipartite patella، راح نشوفه بأحد الأشعات القادمة. Next slide. See, this is حتى خلينا عليها فد أسهم اللي هو congenital bipartite. أحيانا الإنسان يخلق وعنده الباتيلا هي مكونة من نصفين، فلا نتوهم أنه هذا راح يكون regular line، فد line متناسق، خط عدل، ما مثل fractures اللي شفناها بالسلايدات السابقة. Next slide. How to treat fractures of the patella. How to treat fractures of the patella. Now, undisplaced fractures or minimally displaced crack اللي هو ما متحرك يتكسر واحنا نتوقع الكوادرسبس mechanism is intact، اهتم أولا بالهيمارثروسيس. If it is very big hemarthrosis you can do aspiration of the hemarthrosis. زين إذا كان الهيمارثروسيس قليل just a small swelling, what can we do? The best thing in my opinion is to do ice application. If you don't want to do surgery, ice application is very good in the first 1 or 2 days. It will limit the internal bleeding inside the joint. The second point is POP cylinder cast for 4 to 6 weeks. and then start by quadriceps exercise. يعني ممكن تخلي التجبيس مثل ما نقول تجبيس أو مثل ما نستعمل حاليا أحيانا الفايبر جلاس. We applied for 4 to 6 weeks. طبعا بهاي الحالة أثناء هاي الفترة المريض راح يكون in bed rest. ممكن أثناء هاي المدة أيضا نحول هذا ال POP cylinder بنصف المدة مثلا ب3 أو 4 أسابيع نحوله إلى brace, functional brace. But the most important is to then start active quadriceps exercise, because you are going to have wasting of the quadriceps muscle. It will happen very rapidly, and you are going to have knee joint stiffness. Remember, knee joint stiffness and muscle wasting, it takes very hard efforts to regain power of the muscles and mobility of the joint. So physiotherapy here is very important, extremely important. Next, what can we do for a comminuted or stellate fracture? Well, in case of comminuted stellate الكسر النجمي هو متفتت ولكن هو ما متحرك من مكانه, and the extensor expansion is intact. يعني إلى حد ما الextensor mechanism is still acting, still good. But the undersurface of the patella is irregular and may damage the patellofemoral joint. So if we can do fixation in a reasonable position, ممكن أنه نرجع نثبت نربط هاي الأجزاء بشكل معقول. إذا big pieces فنحن نثبتها, نحاول نثبتها وننتظر الهيلينج وبعدين نعمل physiotherapy. Otherwise, if it is very severely comminuted and you expect that the healing will be in a erratic way, راح يكون يعني فد healing بطريقة خاطئة, أو الأندر سيرفيس أو الارتيكولار سيرفيس راح يكون ما جيد, irregular, راح يكون خشن, فراح يحك بالجوينت سيرفيس اللي هو الفيمر articular cartilage. This will lead to later pain, further stiffness, and maybe osteoarthritis. In this case, some surgeons would advocate patellectomy. Next slide. Displaced transverse fractures. This is a very classical picture of a displaced transverse fracture which happens due to indirect force اللي قلنا له quadriceps pull of quadriceps mechanism تقطع الباتيلا إلى نصفين. So knee extension is impossible. Initial fixation by tension wire with back slab. طبعا من البداية هذا ما راح يفيدنا أنه نعمل فد conservative treatment, ولكن الفكرة أنه نعمل tension wiring. طبعا أكو طرق عديدة حاليا لهذه التنشن, أنه you fix the patella under tension. ليش؟ ليش تحتاج تنشن؟ هذا التنشن تحتاجه لأن هذا العظم تحت ضغوط قوية من الكوادريسبس مصل. قلنا عضلة عملاقة الكوادريسبس مصل, فعليها بون عليه ضغط قوي, سحب قوي, لازم نعمل fixation under tension. ولهذا نخليه مثل ما تشوفون بالصورة 2K wires, بعدين هاي 2K wires نرجع نربطها في stainless steel wire ونضبه هذا حتى نعمل tension. Next slide. See, this is another example of a fractured patella that was fixed by multiple K wires and figure of 8 tension wire, and the reduction is very good. The last object I think in this lecture is dislocation of the patella. Dislocation of the patella. The patella is not very commonly dislocated, but we see it from time to time. So what happens? Knee is normally in valgus. Knee is normally in valgus. So the quadriceps tendon tend to pull the patella laterally. Sudden severe quadriceps contraction with the knee stretched in valgus lead to lateral dislocation of the patella. هذا الكلام يمكن نفتهمه إذا نشوف السلايد next slide. شوف هسه next slide راح شوفنا أول وحدة صورة الني. وأنه direction of pull of quadriceps muscle is towards the lateral side. شوف هذا الأنجل راح شوفنا أنه the quadriceps tends to pull the patella to the lateral side. So in the normal situation there are strong ligaments and configuration of the condyles of the femur. يعني الكوندايلز تكون مش مركبة بطريقة بحيث تحمي الباتيلا من الديسلوكيشن، واكو اكيد ليجامنتس ايضا تمسك الباتيلا ما تخليه تطلع لا لاترال ولا ميديال. لكن في حالات معينة نتيجة انه يصير خلل او اكسسيف فالجاس، مثلا واحد عنده جينو فالجم خلينا نتخيلها، او تجي فد تروما كلش قوي تو ذا ني، ممكن تطلع الباتيلا من مكانها تعمل lateral dislocation of the patella. عادة dislocation is lateral. Next slide. The clinical features again are the first, when there is a first time dislocation، أول مرة يجي الولد أو البنت، عادة هذا احنا نشوفه بالبنات المراهقات أو الشابات الصغار، يعني بعمر 13 14 15 إلى 20 سنة. More in females actually. So the first time dislocation there is tearing sensation، يحس انه المريض يحس فت pain وانه شيء تمزق بالركبة، and the patient usually collapse on the ground، ينكبح المريض من تصير عنده dislocation يقع على أرض يتكوم ينكبح. The patella may remain dislocated or spring back into position spontaneously. بصراحة أكثر المرضى يجونا على الطوارئ أو على الكلينكس يجي انه هذا كان انخلعت الباتيلا، واثناء ما عيصيح هذه من حالة تشط ترجع على مكانها الباتيلا، it springs back into position. But anyway, we have seen many cases where the patient presented to the emergency unit with his patella outside or laterally situated laterally. This is the first occasion، هاي أول خلع يصير. ليش احنا نقول first occasion؟ من انخلع وصار tear of the ligament و يعني change in the muscles، صار weak points in the muscles خلينا نقول. فممكن أنه يكون بعض المرضى إذا ما تعالجوا بشكل صحيح معرضين إلى recurrent dislocation، يعني كل مرة تطلع وترجع الباتيلا، تطلع وترجع. أحيانا يصل مرحلة يقوم هو بالبيت من تصير عنده يرجع على مكانه. So next slide, you see this is a patient with his patella outside، اللي right patella outside، تختلف عن الباتيلا on the left side، and the X-ray shows the patella on the side of the knee joint. This is how you see it in X-ray too. Next, see this is a young lady with recurrent dislocation of the patella. See the arrow is indicating towards the patella، هاي الباتيلا مالته يصب صيغة تشوفوا هذا البلاك arrow. Next, how to treat patellar dislocation. Treatment is by reduction with or without anesthesia. أحيانا تحكي مع مريض تنطينه أنالجيسيا، تعمل له distraction وبعدين بحركة بسيطة ترجع على مكانه. Then you put a back slap for 3 weeks. قلنا ليش؟ لأنه أكو ligaments كان صار بها injury، muscle كان صار بها tearing، hemarthrosis، pain. This back slap will help reduce these problems or heal these tears. Then recurrent dislocation occur in patient with أحيانا تركيبة الباتيلا أو تركيبة الني تؤدي إلى recurrent dislocation. مثلا هاي الأمثلة small high patella أو excessive genovalgum مثل ما قلنا. إذا هي الباتيلا صغيرة هي تظل طيفي، تروح يمين وتروح يسار وتنخلع. بعض المرضى عندهم congenital joint laxity، يعني عندهم فد رخاوة ما طبيعية بالليجامنتس، فممكن هذول يكونوا معرضين أكثر للكني dislocation. And these recurrent dislocations usually need surgical treatment because it's very annoying. هذا المريض خطي كل ما يطلع ينزل مرات تنخلع وتوقعه مرة مرتين ثلاثة. وعامة الشباب عادة يحتاجون إلى حركة ويحتاجون إلى big activities, sporting activities maybe. So we need to do something for them اللي عادة surgery to reconstruct the ligaments to أحيانا حتى البونس نغيرها مثل الجينو فالجم لازم نصلحها وهكذا. So this is the end of the lecture regarding the knee joint problems and the knee joint traumas and femoral shaft fractures. Thank you for listening and ready for any questions inshallah.